Well, thank you everyone for joining us. This is our town council meeting for Tuesday, August 17th. It is 6:01. We'll call the meeting to order. Roll call, please.
Council members Dennison, Droz,
Here.
Lombardo,
Here.
Schooler,
Here.
and Mayor Abel.
Here. If you'll please rise, we'll have our Pledge of Allegiance. Following that, we'll have Mike Grumpy Kelleher, the San Bernardino County Sheriff Chaplain, lead us in an invocation. Ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let us pray. This evening, Lord, as we ask our town council to look to you for wisdom and guidance with all this crazy things going on in the world, Lord, I ask that you give them your peace, your guidance as they lead Yucca Valley into the future. And tonight, I lift up the San Bernardino County Sheriff's deputy that was shot this afternoon in San Bernardino. I lift his family and the department to you. Lord, we thank you for all of our first responders, our military, they keep us safe, they give us the privilege to be able to have meetings like this. So Lord, I ask your wisdom and guidance and your grace over this meeting. In Jesus' name we pray. Amen.
Amen.
Very sobering reality, and we do appreciate all those who serve in uniform to help protect our communities, our country. And we do lift up that family in prayer right now. Well, we have some presentations and introductions, but we're going to start off with a fun one. We have 3 new employees, so we're going to hand it off to our personnel director and go ahead and do some introductions.
So if I could ask Susanna Straw to join me up front this evening.
Do they want to do the traditional dance?
So, you know, as we have been, some of us have been in this business for a while, and the beard has gone from brown to gray and the hairline is going back, but then you reach the point where you're bringing on board employees that are younger than your own children. And that's when you know you've reached a certain point in life. So Susanna has come to us as the new engineering technician. She's been with us for a few months. Some interesting facts. She was born in Russia. I could try and pronounce her maiden name, but I would butcher it horribly bad. Moved to the United States in 2002. She currently lives in the city of 29 Palms with her husband, 2 cats, and a dog. She earned her bachelor's degree in civil engineering from UC Davis, and if I remember her resume correctly, she did that in 4 years. That's huge to complete that program straight through in that 4-year period. And she has obtained her engineer in training certification. She currently helps the engineering department with the processing of permits and answering questions. Specifically, she's done work on the town's 5-year CIP, which is getting ready to go to Planning Commission and then to the Town Council. She works on grant reimbursements on our federally funded projects. She works on encroachment permits. And the most important thing that she probably does on a daily basis is she helps keep Armando in line. So anyway, we would like to welcome Susanna to the team, a great addition, and it's great to have her on board.
You don't have to.
She asked me if she had to speak, and I said no, so she's happy to be a member of the team. She's great, great member, gets along with everybody. Works very, very well with the public, but she's also very quiet. So anyway, it's great to welcome her on board.
Welcome, thank you.
Next up, Evan, if you could join us up front, please. Evan Willoughby was recently hired as our planning technician. Evan comes to the town with a bachelor's degree in urban and regional planning, I believe from Cal Poly Pomona, and he is currently working on his master's degree in urban and regional planning. He currently assists the planning staff, planning department, intaking and processing minor permits, front counter, phones, those types of things, but more specifically, native plant permits, which is a huge workload on staff these days, along with the Western Joshua Tree permits, the state-imposed regulation over those Western Joshua Tree permits takes a lot of time. Short-term vacation rentals, I think everyone knows that activity level is very high right now. A lot of phone calls, email inquiries, front counter inquiries, and one of the conversations we had during the interview process, when you're in planning and you're in large organizations, many times you get compartmentalized. And it takes a long time to climb the ladder and get to do certain things. And one of the things we talked about in the interview was making presentations to the Planning Commission. So told Evan, hey, if that's the path you want to go down, we'll make that happen. So within 3 months of employment, first job in his professional planning career, Evan is making presentations in front of a planning commission. So been a great addition to the team, works extremely well with the public, very organized, very structured, knows the importance of customer service and keeping those permits moving. So it's with great pleasure to introduce to the council this evening, Evan Willoughby.
Hi, everyone. Very briefly, it's good to be here, and I look forward to serving the community. We met very briefly at the joint council meeting, but it's nice to see you formally. Thank you.
Thank you.
Mayor, we have one additional new employee. It's my pleasure to introduce Miss Rachel Boyer across from me there as the town's new finance and accounting supervisor. You always wonder what kind of applicants we might get and what kind of responses we get, but one of the questions that we asked in our interview was what degree of accuracy is the standard for you, and if you had to be pressed for time, what would you give? And Ms. Boyer's response was, it has to be 100% accurate 100% of the time. So that's exactly what we want to see on the finance side. Super excited to have Rachel. Rachel comes to us by way of relocation out of Washington. Rachel and her family are in Joshua Tree and recently completed her MBA out of Washington State University just this past June, right? If I remember right. So she's got a full learning curve. We kind of believe in trial by fire. So you come here and start in July, and the first thing you're tasked with is closing all of our books and preparing our annual report and going through the audit process. So she's underway with that, doing a swell job, and so we welcome you, Rachel, and are super excited to have you here.
Thank you. I'm really excited to have the opportunity to serve the town, and I look forward to using my experience to continue the fine work of my predecessor and the finance department of the town of Yucca Valley.
Welcome.
Thank you.
Wow, Washington State University, Cal Poly Pomona, and UC Davis. We hit it out of the park. So welcome to our team. We hope you really, really enjoy it. We look forward to seeing you at many occasions and work closely with you all. So again, welcome and thank you for being here tonight so we can see you in person. All right, we'll move on to our next presentation, San Bernardino County Emergency Nurse Communication System.
Good evening, Mayor and Council. I'm happy to be introducing this item. We have a number of folks here that's going to be explaining this new and exciting system to help with the response times in our community.
100% accurate 100% of the time. I love it. I like being married, so I realize my wife is also 100% accurate 100% of the time. I'm Dan Muncie, I'm Fire Chief. I've been living in Yucca Valley since 1992. I'm proud to call this my community, and I love living here. I've realized as a fire chief that there's a lot of innovations with technology that we can do to serve our customers, whether it's in Yucca Valley or Lake Arrowhead or the other 60, or Fontana, Upland, the other 66 communities that we serve. And I'm proud to introduce two of those innovators tonight. One that you might recognize is Monique Reza Arellano, who is from San Bernardino Council of Governments. She's been absolutely very supportive of innovation and public safety, as SBCOG has. The second is Art Andreas. Art was a mentor of mine as a deputy chief for the City of Ontario Fire Department. And the moment he retired, we quickly captured him and hired him as our director for our JPA, Confire JPA, which is a dispatch agency. Art stepped into the fishbowl and immediately stepped into this ECNS, or Emergency Communication Nurses System project. I've spoken a little bit about it as I've given you updates on the fire district, but we're really making a point in going out to the different cities that the JPA serves and educating the public and our electeds on what ECNS is and what it's not. So I'm going to turn the microphone over to Art. Thank you.
Thank you very much. I appreciate your time. I know you guys have a lot of important business to take care of, but if we could just spend a couple of minutes and make sure we answer your questions before we leave, I think it'll be important. As the fire chief mentioned, this is a very unique program to the state of California. It's not unique to the world. Dispatch centers typically are governed by the International Academy of Emergency Dispatch. They set the standards. It's kind of like the American Heart. They tell you exactly how to do the CPR, and then you can innovate and adapt and make that even more important for your community. So where we are different than many of the dispatch centers is that we're an accredited center of excellence. The fire chiefs have made that a priority. They've invested the time and the money to make sure that we're operating at a level that only 3% of the dispatch centers in the world are operating. And that allowed us to embrace this newer program, which is the Emergency Communications Nurse System. What we've done a very good job of in the fire service is to teach people to call 911 when there's an emergency. And we've been doing that very well for many, many years. What we haven't always done a very good job of is explaining what a true emergency is. And so really what we find in most dispatch centers right now, they're inundated with a lot of 911 calls. The police service is facing the exact same challenge, but not all of those are true emergencies. And so really we started looking at what is another problem in our community is the long wait times in the hospitals. The ambulances get there and there is no place to put them. And so a lot of these people that are getting in an ambulance and going to the hospital probably could be treated someplace else. So the International Academy developed this ECNS program that allows us to take EMD, the Emergency Medical Dispatch, and that's really a prescriptive set of protocols that when you call 911, they're asking you questions to validate what type of emergency that is. And they really have done it to a level that we can safely identify what level of acuity. And so an alpha or an omega call would be a low acuity call. That's you kick the wall and your toe hurts. Not saying that you don't need to get an x-ray and it might not necessarily go away on its own, but an echo call is the true medical emergency where you probably, if you don't do CPR, they're not going to survive. So with certainty, we can put those into different categories, and we know that those alpha calls probably don't need a fire engine and an ambulance with the paramedics going lights and sirens through the street, getting there and then taking that vital resource and putting a person that doesn't need to go to the emergency room in the back, and then taking them to the hospital and having them wait 3 or 4 hours. So it's really an inefficient model that we do, but we've been doing it for such a long time, we just didn't know that there was something better to do. We really focused on this as a priority, and the goal was to enhance the system. What we have done is always answered 911 calls, always sent the fire engine with the paramedics and an ambulance to those medical calls, and we've rarely done anything different other than the way we treat the people once we get on scene. Confire is one of 4 dispatch centers in the county. They are Ontario Fire Department, Barstow Fire Department, CAL FIRE has a footprint in Highland and Yucaipa, and then the rest of the area is served by Confire, which Chief Muncie said was a regional JPA. So early on, the fire chiefs got together and said we can leverage an economy of scales and put our resources together and do it better and cheaper and faster, and that's exactly what Confire has done since 1990. Those are the cities that we currently serve, and that is encompassing the 20,000 square miles that the county is, other than those other 3 cities that I mentioned. What we didn't really anticipate was COVID. So we've been working on this project for a couple of years on how do we find efficiencies, and really COVID accentuated the problem. There was a lot of surge that was anticipated in the hospitals. They had no way of mitigating that, and they said, we heard you've been working on this program, can you get it up? And we said, we've been working on it, can you get it up now? And so there's a sense of urgency to mitigate the threat from the number of people that were coming in the emergency rooms that were not highly acute patients because those beds were very limited and the resources were very limited. So we were very much given support by the fire chiefs to say, make it happen and figure out how you do it. So sometimes we say we're flying the plane while we're building it. We would have been very much purposed if we would have had grant monies to roll this out over a period of a couple of years, come out and make sure that the messaging was clear with the community like we're doing now, the PSAs were done, and we didn't have that opportunity. We were able to be very innovative though, and I say we're the first ones in the state of California, but there are other vibrant programs in the United States, and the International Academy actually implemented this program in many countries. The entire country of New Zealand, Spain, Australia, England, they all do ECNS as their model for the entire country. And so although we're early in California, you would think that other systems would have already done this. Reno had actually published a white paper because they've been doing this since 2012. They are like for like, so they have the exact same EMD protocols that we have. They're an accredited center of excellence, and their nurses that are in their center are California licensed nurses because of the close proximity to Tahoe. So what we did was take CARES Act monies and said, Reno, if we can tell you that these are the low acuity calls, can we develop our director of resources, and I'll explain what that means in just a second, can we transfer the calls to you, and you act as though you're us and handle that call for us and be able to take the right person to the right place, the right time, and really that's exactly what we're doing, the right care right now. And oftentimes that's not going to the emergency room. On those low acuity calls, it is basically taking the person out of the 911 system safely and get them the appropriate level of care. It becomes a concierge service, and really we've seen nothing but, I shouldn't say nothing because there's been some people that are not familiar with the program that have asked more questions, but there's been a great response from the public that's very satisfied with the way the nurse handles the call, because once the 911 operator determines it's a low acuity call, we're keeping those of resources, the fire engine paramedics and the ambulance available for the next medical emergency that's a higher acuity call. That call gets transferred to the nurse. They further validate the assessment was correct, and then they say, okay, we understand that you live right here. There's a clinic right here. Why don't we call that clinic and let them know you're coming, and you're going to get the exact same level of care, and you'll be out of there in an hour. That's the level of concierge service that we're giving to the customers right now. It's important that we collect the data. We knew how many people, when they call 911, of our 237,000 calls last year that we processed were in that low acuity category. So that's hypothetical in our business plan on what is the target audience that's out there. And it's important to collect that because we really don't have a funding stream that's sustainable. And so our sustainability pathway, we believe, is through the payers. The insurance companies do not want to have to, including the federal government, pay for people going in an ambulance and go to the emergency room if they can get the same level of care in an urgent care or the primary care physician's office. These are the different zip codes. This is demographic information that we normally wouldn't collect on a 911 call. It's about rapidly processing the call and getting the appropriate resources out there. So you can see we're touching all portions of our county. I caution to get too focused on the numbers in here because this is first quarter data. It's still a work in progress. We still have a lot of mitigating factors that are in the process of getting better. So we're seeing improvements, but don't focus so much in the numbers, but as the matrix. And so although we normally wouldn't ask you where you live other than to validate the address so we can send the right resource there, we do have the ability of now breaking it down by age category as well as the address. And this is important because if we're seeing an uptick in the older adults, is it because that they didn't make a follow-up appointment? Is it because there was nobody there to care for them? So this becomes a social services test pool for us to understand why are these people calling 911 when they're low acuity calls. This is what their recommended level of care is available to the nurse. And so the nurse can validate that the patient falls into the appropriate category of being low acuity. And from your left, that emergency response, those are ones that actually get put back into the 911 system. So just because they're taken out doesn't mean they never return. This was an interesting data point for us because I'll talk about some of the vulnerabilities that we didn't know until we started the program. But oftentimes, the reason why they're going back into the system is because they don't have an alternative transportation. So people are calling 911 because they don't have a ride. That's an expensive ride to the emergency room. And so we definitely need to address that concern. But oftentimes the person does not want to seek alternative care and they are adamant about going. We would not deny somebody from taking an ambulance to the emergency room, or in fact that the initial assessment was incorrect and it was a higher acuity call. And so from a safety perspective, the nurse puts it back into the system. And then you go all the way down to the right where it's basically just providing information. When we had a person call yesterday, they had a bruise that hurt. You wouldn't probably normally think about calling 911 for that, but that's a real call, and the nurse advised them to put some ice on it, to rest it, and to take some Tylenol. So that's the level of acuity, and then there's everything in between. Oftentimes, these are urgent care patients. We've seen the urgent care has seen uptick in the number of people that are going there, and they're thankful because these people normally wouldn't have considered that. They wouldn't believe that that was the level of care that they need, or they could get the appropriate level of care there. All the way down to it's something that can wait. It's definitely something that you should talk to your doctor about. Why don't you schedule an appointment and get over there in the next couple of days? So this is that same information presented in a percentage. In that top one, those 40 calls, I already talked a little bit about that. We'll talk about the lessons learned in a second. But the International Academy likes to see that between 1% and 7%, the number of people that are going back in the emergency room, so we're right around where we need to be. The rest of those are very much important to us because as we go out and talk to some of the payers, the Kaisers, the IHPs, we want to be able to tell them these are the numbers of people that we're taking out of the system that if we didn't have this in place, would be going to the hospital and emergency room. The trending is that we're keeping the ambulances and the fire department paramedics available for the higher acuity calls. You would hate to have for San Bernardino County Fire to be somebody in somebody's living room that stubbed their toe, and then down the block, other side of the city, they had somebody that had a significant heart attack, or they were having a stroke that was time sensitive that you needed to get them accurately assessed and transported. So really this is where this becomes very much a benefit to your community. We're reducing the number of ambulances that are waiting in the emergency room. Those ones that are going in become those true medical emergencies that need to be seen in the emergency room. And we're really, I think, finding that this concierge service is something that the customers, our citizens, are really appreciating, that they're getting the right level of care. Another anecdotal story, and from the high desert, we had somebody who was a Kaiser member that called the 7-digit number. Everybody has them. They're just not necessarily always satisfied with the service because they ran out of their medication. They were going to get an ambulance ride to the hospital to get their medication refilled when the nurse would be able to say, hey, do you realize that there's a Kaiser clinic right around the corner? Why don't we call them and tell them you're coming and that you're low on your medicine, we'll get it filled. So that's the type of service that they're getting from this program. The 44% is the number of those calls that are getting back into the system that are going back into the system because they don't have an ambulance ride. So we're looking to partner with the Ubers and the Lyfts. That's just one example of how we can partner with IHP that already has agreements with them to say, okay, we realize you don't have a ride. We're going to arrange one for you. We're going to call right now. They'll be there in 2 hours and they'll take you to the clinic. And then the stakeholders that we've been communicating with, law enforcement's a perfect example. We didn't do a very good job of communicating that we were going out. There was oftentimes police officers showing up on those medical incidents. Where's the fire department? Same thing happens with the public. When I call 911, I expected the fire engine to come lights and sirens. So Monique will talk a little bit more about the PSAs that SB COG's helping to fund. But really, we've been talking to HAS, the hospital associations, all the way through business council to make sure that now that we have the program up and operational, although we did it during the height of COVID, we have some catch-up work to be doing. The public outreach, I'll defer to Monique, but definitely I think that the Reno model is something that we learned from, that they have had their program up and operational for a while, but they did this in advance, and the community now actually has an opportunity of even calling into a 7-digit number, so we plan to go that way. We have had other counties approach us, hey, we're smaller in nature, our dispatch center, it would be cost prohibitive for us to hire a nurse. Could we do like you did with Reno? Could we direct or develop the directory of resources? Then once we identify the low acuity nature of the call, we'll transfer it to your center. Absolutely a way that we can leverage our JPA and potentially be able to provide a service to outside our community. We did talk about the alternative transportation. Telehealth is a big component. We really are taking our dispatch center and not just embracing the innovation that ECNS brings to it, but the next gen 911, we're going from an analog to a digital system that'll allow a lot more interoperability on taking your cell phone and be actually opening up a link so you're looking at the person when you're talking to them. You can imagine if you're a paramedic and you're out there with somebody that is having a significant event, whether a shot or stabbed, you're actually physically touching and you're getting more information. If you're talking to them, you're having to base on their response. And oftentimes it's the difference between watching a movie and feeling like you're in it versus reading a book and your mind goes a different place. So the telehealth, connecting the doctors as well, that may be the recommended level of care, is that we're going to have you talk to the doctor right now. They'll fill your prescription. They'll tell you what the next steps may be. And we really believe that'll be the next evolution for our program. Short-term funding, I talked about one of them, that's been CARES Act. We definitely have a unique alliance with SBCOG. They really were excited about this program. It represents all the communities, and that's the touch point, I think, from why they wanted to be involved with it. They allowed us to hire a consultant and really have been helping facilitate along the way. One important part, and I think that's worth noting, CMS, Center for Medicare and Medicaid, is a federal umbrella for all healthcare dollars. They really paid attention to the white paper from Reno in 2012, and they are actively trying to find efficiencies in the healthcare system. So they have a model called ET3, and it's basically triage, treatment, and transportation, and they have an innovation fund that basically is setting money aside to break those parts away from the whole and saying, how can we increase efficiencies in all? So they already awarded some monies to model participants across the United States to look at alternative destinations. We're in the process of looking at it in California. The second T, which is the NOFO, the Notice of Funding Opportunity they just released, was to specifically look at triaging the calls, exactly what we're doing. And so we had put together an application. We're waiting to hear, hopefully by mid-September, whether we'll be awarded the monies, but that really is going to be our lifeline. Those CARES Act monies will expire. We have no additional monies, and so we really need to validate the data that we know to be there, to have that conversation with the Kaisers and IHPs and say, this person would have gone to the emergency room, it would have cost $5,000, could you pay $150 per your identified members as a cost savings to really increase the efficiencies in the system? And we believe that there's a good mechanism to do that, and they've been sitting at the table having those conversations with us. That's that cost avoidance to the ratepayers. All right, Monique?
Just really quickly before we get to questions, I just wanted to give an update on the outreach process that we've been going through at SBCOG. I'm Monique from San Bernardino Council of Governments, and I just wanted to let you know that we are the lead as far as coordinating the outreach efforts for this particular program. We are working with all of the local agencies, including Ms. Leslie Copeland, and we are excited about the launch for the local agencies to occur. It's likely going to be end of September, early October for a county-wide push for getting the information out to the public. We have hired a consultant. They are working on a handbook as well as a toolkit that we are going to be providing to the local agencies. So we are going to design all the graphics, create a scheduling template for the local agencies to use, pushing out for social media posts and things of that nature. And like I said, we're looking at the end of September, early October to really get that going. So with that, I will open it up to questions.
All right, very good. Any members of the public would like to ask a question about the presentation on the ECNS program? Yes.
I'd like to make a suggestion.
Yeah, come forward.
Hi, how you doing, everybody? It's the only mask I had.
Oh, that's all right. Thank you.
Why don't you have like a paramedic on duty at the fire station, so like the stub toe thing, to where I could just go there and so you don't have to use the resources of sending someone out to my house. I could drive my own car down there, and that's just
Okay. Very good. Thank you.
Have a good day.
Thank you.
This happened today, so I believe any member of the public shows up at any unannounced time at the fire station, those folks are more than happy to help.
Okay, so if you didn't hear that response, that they do have the capability of helping you if a person chose to drive to a local fire station to seek help, then they could. Was that the?
I'll defer to the fire department. I don't want to
Okay.
imply that that's the recommended. It just, if they were in fact to show up. the fire
Oh, I
department
got
would
you.
help.
Since 1977, all of Yucca Valley's fire stations have been paramedic. As a matter of fact, they were amongst the first in California to be paramedic. So on duty every day is probably anywhere from at least 4 to 8 paramedics. If they're not paramedics, they're EMTs, and they can help with those minor calls. But I think it's super, the idea really on the 911 system is that people are calling 911 for different reasons than when I first started. When I first started, it was really about people that were having heart attacks or severe trouble breathing, or were trapped or otherwise incapacitated. I think I told a story last time I was here. One of the last calls I ran as a paramedic on a fire engine was for a backache. And as we arrived at the person's house, I went to the patient to assess him. And I said, "Sir, I'm Dan Muncie. I'm a paramedic with the fire department. what's going on? And he said, don't touch me, don't touch me. And I said, I'll be gentle. And he said, oh no, I called you because I need the TV moved over 6 inches and my back hurts. And so we're really trying to take these types of calls back out of the system because we're responding a very expensive fire engine, code 3. We're sending an ambulance, code 3. We're taking these really important firefighters out of the system where they can't help other people. So we want to take these low acuity calls and make sure we're connecting them with the right care. But as always, any of the members of the public, if they want to come by the fire station to get a blood pressure check, if they have a wound that they want checked out, we have people that are on duty every single day. Now, they might be on a call, but they'll be coming back.
Thank you. My question is that obviously this program is going to be cost savings and more efficient, so the people get the actual care they actually are needing at the level they need, but also in turn, we're saving the taxpayers and the county a substantial amount of money by putting this system together. Is that correct?
Yes, sir. The cost with putting more resources into the system is far outweighed by appropriately putting the right care to the right person to the right time. So you could continue to have 911 calls escalate. Every year we're seeing an increase of anywhere from 10 to 12%. Those aren't all medical emergencies, but the volume of those calls require a response. That means building a new fire station, adding more paramedics, when in fact, if we can really triage and use the system the way it was designed, safely and accurately based on evidence-based protocols to say that this is not a true emergency, we can avert those resources from being committed to that, which by and large not only prevents the person that really does need it from a delayed response, but there is a cost savings here from you as a community not having to invest more into the system.
Right, so it saves money and can potentially save a lot of lives as well.
Yes, sir.
You talked about the number and the percentage of those transferred back to the 911 system, and you're saying that the majority of those weren't misdiagnosed, they just didn't have perhaps transportation, or they couldn't get the help that other agency could provide.
Yes, sir. So 8% currently in our model has been calls that have been transferred back into the 911 system. Those 8% represents a number. Whatever that number is, let's say it was 100, 44% of them are being transferred back in. So 44 of that 100 were transferred back into the system because they didn't have a ride.
Okay, and it wasn't because of misdiagnosis from the question in? Okay. Well, that's comforting, because time is of the essence when it's a real medical emergency, so great. Yes, Councilmember Lombardo.
Are the call centers experiencing any difficulty in, when you use a call center, it's not local, am I correct in that? It might be in San Bernardino for this area or something like that. So they're not as familiar with our locale other than on a map. Do they have problems coordinating people that are using, I'm next to the 7-Eleven on Yucca Trail. Do they have problems coordinating, help getting to the right place at the right time?
So let me make sure I answer your question correctly. The dispatch center that covers this area and a majority of the county is Confire. So their footprint is in Rialto and in Hesperia, 2 centers, but it's 1 dispatch center. So the 911 call that comes in depends on whether it came in from a cell phone or if it came in from a landline. If it comes in from a landline, it's automatically populating the screen. If it's coming in from a cell phone, then the caller has to tell us clearly where they're at. Now, the technology has evolved, and we're actually going to be able to implement next week. It's called Rapid SOS. And so it'll take the coordinates from your phone and it'll automatically populate the screen, and so we'll know exactly where you are. Otherwise, we have to rely on you being able to tell us, and landmarks can be a challenge, especially in remote areas that don't have physical addresses.
And when you say populate the screen, that's the map of where that location is and all the landmarks or identification?
Yes, sir. The dispatcher is sitting there and has a screen in front of them. One of them is a map. And so they have the regions that populate on that map, and they would know exactly where that person was and exactly what address it was based on the technology that's available today. Next Gen 911 is going to take it even that much farther, but because the fire chiefs have been very supportive and have really invested in the innovation, we're actually going a little bit early with the Rapid SOS program next week.
Very good. That's exciting.
Wonderful. Any other questions? Sounds like a wonderful program. We really appreciate you taking the time to share it. It's exactly what's been needed for a long time. I'm glad we're able to address it. So great job. Thank you.
Thank you for your time.
Thank you.
All right. Do we have another San Bernardino County fire update? I believe that's our next presentation. We got everybody here. So thank you and welcome.
Awesome. Thank you. Thank you, Mayor and Council. Yeah, we are fire department heavy tonight.
Yeah.
That's a great program. I'm very proud of that program. It's nice to see innovation, things that kind of make sense that you would think would just be, common knowledge or common sense being put into play. So tonight I want to give you a quarterly update. This is for the quarter that ended June 30th. And I meant to give it in July, but I missed the July Town Council meeting, so I'm giving it to you late in August. But it kind of worked out well because we got some really good, exciting news in the meantime. So
Awesome.
Tonight I'm going to talk about three kind of major things. Number one, where's my clicker? There it is. So number one, the Yucca Valley Fire Station replacement.
So you did bring us a fire station.
Well, I brought you money for a fire station. I was hoping you're going to ask where's the fire station. I was going to say, I don't know yet, but I know where the money is.
All right.
So,
That's
so
a good
yes,
start.
very exciting news. We're going to get a new fire station in Yucca Valley. I'm also going to give you a quick update on some vehicle replacements that have happened over the last year and are planned for the future, and then go over some call stats and trends. So, number one, the big news. $12 million in state funding. So thanks to Assemblyman Chad Mays, we have a line item in the state budget for a fire station in Yucca Valley.
Awesome.
So that money can only be used for that one purpose, which is really good. It's going to be a state-of-the-art fire station that's going to serve the town well for the next, well, this one's been around since 1959. So if we can get one to last at least that long, I'll be happy. As most of you know, the station was originally built in 1959, the station right across the highway here. It was originally a single-engine garage with an office and a bathroom. It was never designed for full-time occupancy. And then over the years, it's been expanded, remodeled, and kind of just made to work for the needs. So it's well overdue for a new fire station. It's going to accommodate the current staffing plus additional staffing. So if we have money down the road, we need additional staffing, it'll be big enough to house those additional staff. It's also going to house all of our apparatus and equipment. So I think everybody knows that we have a ladder truck that you bought us that sits at the Yucca Mesa Fire Station. So that's going to come down here where it better serves the community downtown. And then we also have other vehicles. We have pickup trucks and reserve ambulances and other vehicles that are sitting outside, so it'll be nice to put them all under one roof. Staffing and service delivery, initially that's not going to change. This is one-time money to build a fire station. It's not going to give us any additional staffing. It's not going to change our service delivery because we really need staffing to change the service delivery model. So it's not going to be in addition to any fire stations. It's going to replace the station that we have here. And then we just started the process to work with our real estate services division in the county to figure out where it's going to be, what size it's going to be, what it's going to look like, the architecture, all that stuff is still in the very early planning stages. So we don't have a location yet. We do have some computer programs, some software that we can use that looks at historical call data and can tell us where the best location for a new fire station is. So we'll be utilizing that as well as the resources that the county offers. Next, the vehicle replacements. So I just found out we were awarded a CDBG grant to replace the fire station on the Mesa, or the fire engine, sorry. The fire engine on the Yucca Mesa station is going to be replaced next year, so 2022, it'll be purchased. So it takes a while to build it and get it out here, but so it'll probably be early 2023 before we see it. But that's good news that we're getting a new fire engine up there. And that engine that's currently there is about 10 years old, so it's going to go into reserve status. So it'll be a nice reserve in case one of the other engines goes down for service or maintenance. And then we had some CARES Act funding that we were able to use to buy a new ambulance. So we have 2 ambulances down here at the downtown fire station, and one of them is going to be replaced with the CARES Act funding. In fact, it's already been delivered. It just It's at our shop getting outfitted and doing some last-minute stuff. So it should be out here serving the community in the next couple weeks. And then something that happened last year, but I think it got missed, but we were able to use fire district vehicle replacement funds to replace the engine and one of the ambulances at the downtown fire station. So in effect, really, in a couple of years, every piece of rolling stock we have that serves the community front line is going to be new. So that's really good news. And then lastly, some call stats. So these are the call stats for April 1st through June 30th. Total, we had 972 calls. And then you can see how they're broken down. Now, these are calls, this is dispatched call type. So you'll notice structure fire. We didn't have 15 structure fires. I went through the calls, and we had one, what you would consider a structure fire. It was a shed right next to a mobile home at Burnt Mountain Mobile Home Park. The balance of those, they were reported as structure fires, but we got there, maybe it was a burning electrical outlet or food on the stove or a small fire in a trash can that didn't escalate. So some of these numbers might look a little high. The other one, we did not run 8 hazmat incidents. That's a typo. That should be a 0. The medical aids, that is true, 781 medical aids. And like we always say, that's the vast majority of our calls and the big reason for us to have paramedics on our fire engines. The one rescue, I mean, we don't get a lot of rescues here in Yucca Valley, but that was a legitimate rescue. We had somebody with a hand stuck in a lift gate of a box truck. So, yeah. And then that's about it. That's all I have for you. I'd be happy to answer any questions.
Excellent. I'll open it up to the public again if anyone would like to ask questions. All right. Councilmember Lombardo, I'm sure you have something to say.
You say we're in early stages of planning for the station, kind of a rough estimate of when we'll start to see more solid plans?
You know, I've never built a fire station, so I honestly don't know.
Are we looking at 2 or 3 years before it's
2
done?
years, yeah, probably 2 to 3 years, yeah.
Okay.
Yeah.
But I'll keep bugging you.
Do, yes.
Okay. All right, thank you.
Wonderful. That's great news. I mean, we get great service from the county fire department and so forth, and we're just so pleased to see that finally we're getting some needed equipment for the men and women who serve. I know they have had to make do, and they have to live in it day in and day out and make do with it. So to make them more efficient and also investing in our community with new equipment is fantastic news. So those are fun reports to receive, and I'm sure to give. So congratulations.
Yeah, well, thank you.
And
And I want to thank the town council, the mayor, Supervisor Rao, Chief Muncie. They all worked together to get this pushed through. So it was a team effort for sure.
Oh, absolutely. Well, thank you.
Thank you.
All right, our fourth presentation is going to be a Valley Star service update.
Good evening again, Mayor and Council. I'd like to ask Louis Medina and his team to come up. Louis is an outreach specialist with Valley Star, and they're here to give information about their services.
Okay, very good. You might want to grab the other.
How's it going, everyone? Give you a little bit about myself. My name is Louis Medina. I am the outreach worker at the Valley Star TAPE program. I'm also here representing our CRT, our QUIC, and our adult FSP program. A little bit about myself. I moved out here about 14 years ago, my 10th grade year. I met my wife in high school, been here ever since, and they have not. Awesome. And after we got together, she never let me leave, so I had to make myself at home and get familiar with the community. And since then, that's what I've been doing. And with that process, I started off as a client at the Valley Star Behavioral Health and have now worked my way up to an outreach worker, sharing the services that they provide, how they helped me, and how they help community members around us. So given that, we'll start with the presentation. 2 of our 4 programs that we have are Crisis Residential Treatment Center, which is located at the entrance of Joshua Tree, as well as our Crisis Walk-In Center, which is located right across the street, as well as our adult FSP. They are in the same complex right across the street, right behind Bank of America. Our Transitional Age Youth Center, also known as TAY, is located at the end of town. If you're going towards Walmart and you look to the right-hand side, where the colorful letters on the right-hand side, probably got a bunch of youth outside having conversations, sharing stories, and probably playing some activities. The first program I'm going to talk about is our CRT, which is our Crisis Residential Treatment Center. They are open 24 hours a day, 7 days a week. And what they do is they provide an immediate service to all crisis situations. So if you go there, you go through the referral process, you meet with the team, and if approved, once you get into the treatment center, they provide services. They support you with a full team with a counselor, psychiatrist, clinician, county workers to provide services to allow you to get on your feet and get back to doing what you were doing. Some of the services include therapeutic and mental health services, family inclusion, pre-vocational and vocational counseling, medication evaluation and support services, daily exercise and health, wellness education, and crisis intervention. On the facility, they do provide room and board, shower, laundry room. They have 3 meals a day, as well as a full group schedule Monday through Friday. And during the weekends, they provide recreational, but also vocational and educational groups. Our Crisis Walk-in Center is a 24-hour day, 7 days a week facility. This is a one-stop shop crisis facility. And what we do is when we are talking to community members, letting them know where to go, this is where we ask they go first. This program here is going to allow them to spiderweb them to the surrounding services. So whether you're a youth, a minor, a senior, an adult, whatever you're going through, we suggest going there first, and they're going to link you up with the appropriate resources, whether it's within Valley Star's umbrella or surrounding resources. We link all the way across San Bernardino County, and if the services are needed, we do branch off into other counties, but we span as far as we can go. Last time I've heard of a transport, it was a 4-hour transport to provide services for a client. Not exactly sure where they went, but the staff loves telling that story. So I'm sure if you ever go out there and ask about the 4-hour drive, that staff will be more than happy to share that with you. Our Adult Full Service Partnership, which also known as FSP, is a full service partnership. They are open Monday through Friday, 8:30 to 5, and they are located directly behind the Quick, and they provide individual and family counseling, psychiatric care, medication management, crisis intervention services, intense case management, housing and vocational support, independent living skills training. They are also the same program right now that is serving as the mental health court program. So both those programs are in that building. They are in the process of expanding. We have not got a date of when that is happening, but that is in progress to provide more services for adults here in our community. They also, too, as well, provide group schedules, resource services, linkage with resource, transportation to resources. Not only that, you have a case manager, psychiatric services, clinician, all that to provide you support day in and day out to get through these challenges that you're facing and help you overcome them for you to be successful tomorrow. The last one, I saved the best for last. One, it's a program close to me. It was a program that I started in. It's also a program that I brought 2 of our member councils on to share their point of view of it. This is our TAY Center, and this one is really important to me because this is where it all starts. And if we could help our youth where they are today, some of the other programs that they're going to have easier times helping these adults, or those adults are going to be able to get employed with them and provide services back to their community. Some of the services we include are developing community living skills, recovery from substance abuse, feeling empowered in their lives, developing supportive relationships, identifying and accessing community resources, obtaining and maintaining safe, stable housing, employment and career goals. We provide a Monday through Friday group schedule as well, and this is what our group schedule looks like. This one is last quarters, but the foundation and the creativeness is similar each quarter. And the cool thing about our groups is our youth in our program provide the groups and the topics they want to see. So therefore, we let them know what we're trying to do. They tell us how they want to learn it, and we take that, and very much like a PB&J sandwich, we smash it together so everyone enjoys it. And that's what our group schedule is built off of, the fun names, the creativeness. Nobody wants to go to a group that says, oh, depression, anxiety. No, we change the names, we blend it, we help everyone feel welcomed. The TAY Center is a safe place for everybody, whether it's LGBTQ, whether you're homeless, abuse, You face suicidal ideations. We're a safe place for everybody. So we want the schedule to feel even safer so you're comfortable going in. But also, too, if anybody was to see that, you're not decoding nothing. You don't know what that group's about. And it can be, like, for instance, YouTube and Reflect. You really don't know what that is. And so it's a chance for those clients to feel comfortable saying they're going to that group. A new thing we just started, we started it pre-COVID, and we were supposed to do a live event in San Bernardino County, and this is our REACH project. This project was started by myself, our Taste Center in Victorville, as well as our youth. And REACH stands for Reach Everyone and Change Hearts. And what this program is about is it's putting youth right back in front of youth to share the challenges and how they overcame them and their success stories. We have all been to events where the motivational speaker is really doing great, but they're paid to be there. They're endorsed to be there. Our youth don't have that. They're just there to really empower their peers to become bigger, better them, and to keep pushing forward. A lot of our youth are working at local retails, local fast food places, and it's just giving them that motivation to say, hey, a paycheck is still a paycheck, no matter the size of it. And we're encouraging our youth to keep moving forward and keep progressing, whether it's in employment or education. And two of our speakers today actually helped participate in our last REACH project. Some common mistakes about our programs: the CRT and QUIC are not a homeless shelter. The CRT does provide residential treatment, but it's after the initial referral. It's not, you can come in, stay, unless there is some type of mental health crisis that meets the criteria, they are eligible to stay. The QUIC is 24 hours. You are more than welcome to come back, but community members are not encouraged to go there and sleep and hang out there. If they're in a crisis, if they need somewhere to feel safe, absolutely. And no matter what the circumstances is, I would still call and give them a background of what you're facing, what you're going through right now, and provide that, because our goal is to make sure everyone has some type of resource or some type of services. Obviously, I have guidelines that we have to meet, but more or less all the staff in there have a heart and they do care. So even if you come there and you have a question about what time's McDonald's closed at, well, we're going to provide you that information. Is it going to be supportive to you? At the moment, it may be, but we're there to help you and provide those resources of whatever it may be. The CRT and QUIC is a detox and rehab center. It is not. That is a common mistake. Unfortunately, we do request for the CRT that clients that come in seeking services are at a minimum of 72 hours detox. Anything less than that, they do meet with a clinician, and if they're eligible to get past that and share that they are stable enough to do the documentation and interact with services, then there may be substitutions or exclusions, but for the most part, it's not a detox center. TAN FSP is the housing program. We partner with housing services here. We do know that there's a huge need for more housing, but we do partner with housing programs. Our main goal is the client's mental health and then housing, but we do understand that sometimes housing supports the mental health crisis that they are facing. So we do try to work with the community and provide those services, but we do not offer housing under our program. The QUIC provides inpatient and long-term services. Again, that's another one. We have clients that come in, kind of tag teaming the next one. They come in on a monthly basis for their medication. We do provide psychiatric meds if it's an emergency, or if they are almost out of meds and they cannot be seen by their psychiatrist until a certain time. We do provide that emergency refill as long as they meet the psychiatrist, the nurse, and clinician to make sure that it's the appropriate med management and support. But they do not do regular appointments. Our goal is to set you up with a primary care to make sure that it's continued service. Some frequently asked questions: how does someone sign up for our services? All 4 programs are walk-in. They can walk in and self-referral. Other programs can refer them, but all 4 programs are at-will programs, so if they decide to stay and partake, they're more than welcome to. The only one that has a slight different criteria would be the mental health court for obvious reasons on that. Do you take donations? We do take donations. Currently, right now, we are being a little hesitant on what we're taking due to COVID, but also, too, we are making sure that they're age appropriate. Some of our donations have been, we had a donation a few years ago for shoes. The shoes were, we had about 200 pairs of shoes, and the shoes were sizes 3 to 4, kid size. So we have a bunch of shoes that our young adults cannot fit into. Luckily, we partnered with the Boys and Girls Club and shared those shoes with them, and it worked out. So we do make sure that the donations are age appropriate or useful for the community members in our programs, so that way nothing's going to waste. Do we allow volunteers? Currently, right now, due to COVID, we do not, but some of our field exercises, when we do outreach programs, we do encourage volunteers, so that way we are working with them, they're working with us, and we are help spreading the services that we provide. Will I have to pay for services? All services are free and/or insurance-based. Our FSP program through the TAY is Medi-Cal based, but we also have drop-in services at our TAY program. The drop-in services include groups, a laundry room, shower, lunch. We have lunch, we have snack room. We have a lot of recreational items for our youth to use, and those are all available, no cost to the clients, as long as they are 16 to 25 of age. And then the last one, who knows that I will be there? Of course, just like all mental health work, we are covered by the confidentiality. So once you sign up, after that moment, nobody can know you're there. We cannot identify that you're there unless proper documentation. So all 4 programs are a safe place for yourself and to keep you safe from others. And with that, there's my contact info. But before I go and take any questions, I'd like to invite our member council's members to come up and share a few words, because I feel like it's very powerful to hear from them about our programs. And I feel like their conversations are more appropriate and honest. So thank you.
Thank you. Welcome.
Hi, my name is Brandon, 24 years old. Been going to TAFE on and off for about 3-4 years. Initially, my brother got me there. What I like the most is the groups and the therapy. They really help, especially when you're feeling very emotional. You can call them whenever, even if they're closed. They have an emergency number. You can still talk to somebody. And, anxiety. And,
You're doing a great job. Yeah, tell us about how they've helped.
Okay, I'm good. And they also helped me with that, because a couple of years ago, I wouldn't have been able to control that. I would have freaked out. And but they've taught me ways to be able to control myself. Earlier today, I had a very, very bad panic attack when I was sitting at the house. But I was able to remember what they told me, relax, and I was okay a few minutes later. And I went back out to doing what I was doing. But the groups they have, they're wonderful, because they really make you think of what you're going through, why you're going through it, and what you can do to overcome it. And then sometimes we go out, we have fun, and it helps us distract ourselves for the day. And can you go for me?
Thank you.
Hi, my name is Reed. My pronouns are he, they, and I am one of the LGBTQ plus members of the TAY, as well as he said, part of the member council. Our services, I've been going there since November of 2020, and I originally started as a drop-in service member. Which means that I didn't get to actually meet with a clinician one-on-one or a psychiatrist one-on-one at the TAY. I have since become one of the FSP members as well. So when I first started, I did go to all of the groups every single week. I was there literally when it was open to when it was closing. That is when I was there. And the groups and just being around people my age who are struggling with similar things to me, it has helped me so much. And I know for a fact that it can help people a lot to be around people that are going through the same things that you go through. Everyone there has dealt with anxiety, depression. A lot of us are LGBTQ plus members and have struggled with acceptance, and just even those who aren't LGBTQ plus have struggled with acceptance of themselves in other ways. And the groups and the staff and everyone there will help you figure out who you are and what you want and how to live your life. And that's all I have to say.
Thank you so very much.
So if you guys have any questions before I take those, I just want to share. Doing outreach virtual and in person, it's a whole big difference. You almost forget what to do. So thank you for having us.
Well, we appreciate it. Is there anybody in the audience or a member of the community, online or here, that would like to ask a question of the center and the presentation for the Valley Star Services update? All right, seeing that there are so many services are under your umbrella, and what you don't provide, you provide access to other resources, or you be able to direct people. How big is the youth homelessness issue here in Yucca Valley, Morongo Basin?
Right now, currently, the last time we've done our homeless youth count, it's pretty big. Also, too, the unfortunate part is it's hard to get a very accurate result on it due to sometimes it being really hot or extremely cold. So sometimes our youth stay in shelters. Also, too, though, we also don't have a lot of places for them to congregate safely. Unfortunately, a lot of them are making some unfortunate decisions. So us trying to meet them where they're at sometimes involves us really going on some far out trails, sometimes in areas that staff isn't aware of where to go. So it's hard to get a number, but right now we have youth coming into our program probably weekly seeking housing. And then another challenge we're facing right now is we have currently 14 youth that are employed here in the community or the surrounding communities, and we have 12 in school, whether it's online, CMC. We have one client that is doing Grand Canyon University online, and they are now at the brink of bringing in some type of income, but they can't move forward. So therefore, they're in our housing programs and just stationary, and they can't move forward due to either having to relocate and leave what they're building here, whether it's schooling or employment, or right now they don't meet the qualifications for housing, whether it's credit, enough income. So homeless youth, it has two different pillars. You have those that are not in anything that's sheltered, and then those that are in sheltered that can't move forward out of there due to limited resources.
Okay. Well, and then you talked about donations. Obviously, you're nonprofit and so forth, so you can take financial donations.
Valley Star is a for-profit company.
Oh, is it?
Correct,
Oh,
yes.
okay. But you do take financial donations as well as physical donations, but like you said, you're limited right now with COVID.
Correct, yeah. Physical donations we do. I'll have to check on the financial donations with my supervisor and make sure. I don't see why we wouldn't, since it's for a good cause, but I want to make sure beforehand.
Yeah, very good. Any other questions? Yes, Councilmember Lombardo.
How close are you to full capacity? Are you operating usually at a pretty high level of capacity?
So right now, currently, we are operating at full capacity. Our program manager and supervisor, so we were closed doing telehealth for about 3 months when the pandemic started. Then we had 2 unfortunate situations with clients. And many of our staff members, as much as they do enjoy being employed, helping the clients comes more. So we got together as a collaborative team and found out as many options as we can to kind of get through the bubble of how we can help. And as of September last year, we've been open for full capacity with obvious COVID requirements, the mask, temperature check, and the questionnaire at the beginning. But we've been open at full capacity since September.
Do you still have extra capacity when somebody just walks in? Is there a place for them to go, or do you have to direct them now to some other center?
So right now for housing and therapy, we have to direct them somewhere else.
Okay.
But for shower, food services,
I see.
a safe place to come in and cool off, provide groups, they could come in Monday through Friday. But for the full service partnership right now, unfortunately, we do have a waiting list, not a very big one, but we do have a waiting list.
I see. Okay, wow. Very impressive.
Wonderful, thank you.
You're providing great service to the community.
Yeah, and
Thank you.
then with services for TAY, it's not Valley Star, but there are 4 TAY programs here in San Bernardino County. We have one here, Victorville, San Bernardino, and Ontario, which Andre Basu, who's our program manager of all TAYs, he'd be the perfect person to talk to give you an in and out of all 4 programs. They all run very similar, but since they are different contracts, some are slightly different, but for the most part, all trees look the same.
Do you know how long Trey has been operating?
Dre has been in operation probably the last 15 years now.
Yeah. All right, thank you very much.
Well, wonderful. Well, thank you again for all that you do for our community. Very impressive. You've spoken several times before, and I've heard you, and you always knock it out of the park. So you're a great representative of programming. And thank you for the speakers that you brought along and putting faces and what it means to be part of the program. It sounds very, very productive, and those services are very much needed, as you know. Thank you again for being here.
Thank you.
All right, council will move forward. I need an approval for tonight's agenda.
I move that we approve the agenda.
Second that.
We have a motion and a second. Roll call?
Councilmembers Droz,
Yes.
Lombardo,
Yes.
Schooler,
Yes.
and Mayor Abel.
Yes. We'll move on to our consent agenda. All items listed on the consent agenda are routine matters or formal documents covering previous town council instruction. Items are enacted by one motion and a second without separate discussion unless a member of the town council or town staff requests dialogue on a specific item at the beginning of the meeting. Requests to speak from the public on the consent calendar items should have been filled out with the town clerk. We have items 4 through 23. I'm not going to have our staff read every one of those, but is there any member of the public who would like to speak on any of the consent agenda calendar items? No one online tonight? Okay. Just raise your hand if you need to get me to acknowledge anyone online. All right. Any council members or staff wanting to pull an item from the consent agenda?
No.
Okay.
Mayor, I'll move approval of the consent agenda.
I will second.
We have motion and a second for items 4 through 23.
Councilmembers Droz,
Yes.
Lombardo,
Yes.
Schooler,
Yes.
and Mayor Abel.
Yes. There are a lot of wonderful things in that group of 23, by the way, so if you're curious, make sure you read through those. We'll move on to our department reports. Item number 24, staff report.
Good evening, Mayor and Council. Can you all see me, or should I go up to the
No,
podium?
we're fine.
You okay?
You are.
Okay. I'm hiding back here tonight.
Yeah.
The item before you is the approval of the acquisition agreement for the southwest corner lot at Sunland and Palm. The recommended action is identified in the staff report, and as a background, the town's general plan, open space, and conservation element outlines the framework that addresses the development of the community with the long-term conservation and management of open space lands in and around the town for the protection of natural, scenic, and recreational resources. Additionally, within this element, the general plan relies on the Parks and Recreation Master Plan to provide a roadmap for planning current and future community park facilities. Recently, it had come to the town's attention that the vacant lot located at the southwest corner of Sunland Drive and Palm Avenue was for sale. This lot is located directly across the street, which is Palm Drive, from the former Tri-Valley Little League properties, now known as Brim Park 1, and the Boys and Girls Club. Access to this property could be used for a variety of town recreational needs. The town had an independent appraisal of the property completed, and the final report supports the terms listed in the proposed acquisition agreement. The town then prepared the attached draft acquisition agreement, and the seller, through his realtor, has approved the draft and wants to move forward with the sale of his property to the town. If approved, the sale will add just over an acre of land to the town's, for the town's use, excuse me. So the recommended action to you is that the town council approves the acquisition agreement with Julio Miramontes for the purchase of the vacant lot located at the southwest corner of Sunland Drive and Palm Avenue, known as assessor parcel number 0595-031-08, in the amount of $50,000, plus the payment of all closing costs and brokerage commission fees, subject to a minor change that are approved by the town attorney and the town manager, and authorizing the town attorney, mayor, and town manager to sign the agreement and all necessary documents to open and close escrow and to acquire the property. With that, I'd be happy to answer any questions following public comment.
All right, we'll open up the public for acquisition agreement. Anyone wishing to speak or filled out a card? Hearing and seeing none, we'll bring it back to our council members. Any questions?
No, I think it's Good idea, and it'll be useful in the continuation of our plans for the Bremen Park area.
I have just one question. I do agree, I think it'd be good to purchase that. Out of what account or of the funds will this be taken from to be able to make this purchase?
The funding is out of the town council's established capital projects reserve fund. You already have a line item for property acquisition that will be carried over from your fiscal year 2020, 2021 budget.
Okay, so it wouldn't come directly out of the monies that we get for parks?
No, absolutely not.
Okay, very good. Any other questions?
I'd like to make a motion that we approve.
And I'll second that motion.
Councilmember Strohs,
Yes.
Lombardo,
Yes.
Schooler,
Yes.
and Mayor Abel.
Yes. All right, thank you. Item number 25, resolution, Measure Y project list approval.
Good evening, Town Mayor and Council members. We have a presentation for the fiscal year 2021-2022 Measure I project list approval. The recommendation in front of you is to adopt the resolution approving the project list for the fiscal year 21-22 Measure I funds for the town crack seal and town-wide slurry seal projects as identified in the resolution. A summary of the report that you have in front of you is that the fiscal year Measure Y spending plan was recommended by the Revenue Measure Oversight Commission, and also the fiscal year 21-22 budget was approved by council, and the recommendation and the budget include a $1 million for infrastructure allocation. Town council action is required to designate the projects that are going to be included in this infrastructure allocation. The road maintenance effort that is part of the town's pavement maintenance program is implemented to extend the lifetime of the roadway pavement, and is always recommended to do it prior to the roads deteriorating to the degree where the road reconstruction is necessary. The treatments that the town use are the town-wide crack seal, which is usually done in the winter months, and the town-wide slurry seal, which is usually done in the summer months. The project overview, the selected locations that we have for these years for crack seal and slurry seal were considered by doing the annual review of the pavement management program, field inspections for arterial collectors and local roads, and were coordinated with the HWD water line and wastewater collection system construction sequencing. As you can see here in this map is the town-wide crack seal. We continue with last year's program, doing arterials and collector road, maintaining those ones that they start showing some asphalt distress with the new pavement, and then another ones that are considered for phase 2 that need to be treated. So you can see Joshua Drive, you can see Camino del Cielo, Yucca Trail, you can see Sunny Slope, and Paxton Road are the main roads that are going to be done this year in this project. For the town-wide crack sealing residential roads are focusing on the area to the west of the golf course, and also we have some treatment in Fox Trail, Amador, and Grant. The slurry seal for arterials are focused on Camino del Cielo and Yucca Trail and Joshua Drive, and also the slurry seal for residential is the same as the crack seal, focusing on the west area of the golf course and Amador, Fox Trail, and Grant. The fiscal impact that the town has on these projects, the budget for Measure I infrastructure effort is $1 million. The estimated project cost for the crack seal is $188,000. For the slurry seal is $833,000, with a total of $1,051,000. Staff will return to council for approval of the bid documents and for bid award with the actual cost. That's the resolution, again, that you have in front of you, is to adopt the resolution approving the project list for expenditure of fiscal year 21-22 Measure Y funds for the town-wide crack seal and town-wide slurry seal project as identified in the resolution. That concludes my report, and I will be glad to answer any question you may have.
Fantastic. We'll open up to our public comments. All right, hearing and seeing none, we'll bring it back to staff or council. I noticed that on the project, some of it is slurry seal, some of it is roads that just need crack abatement or fixes. So when they go out to bid, how does a contractor go out and bid a project like that when it's so widespread?
They are two different bids. One is for the crack seal, and the other one is for the slurry seal treatment. So when they are spread, we try to locate them in areas. First of all, they have a schedule on what areas they are gonna be working, and we have the traffic control. We require traffic control when they are spread out, and they usually have a good schedule on how they are gonna move forward working.
Okay.
And the contractors for these types of projects, as part of their bid preparation process, they actually come out and measure. They measure for the slurry seal, they measure widths and lengths, and crack seal, they get out, do some measuring. They may not measure each and every one, but they get a good estimate. And they have, those that are experienced in this, they know how to judge a road, estimate the number of linear feet, and that's how they develop their bid.
So they get maybe a sampling and get an idea that this is probably going to be
Yes, sir.
over the whole thing. All right, and then some of the crack seal is actually on roads that have been recently put in, but they're showing some, trying to keep them maintained at a high level and not let them deteriorate, get on them early.
Yes, we started last year with the package A and package C from the new roads, the moratorium roads that we have in the town. The asphalt is showing some distress, some cracks there, so the preventive maintenance is recommended to do it right now and then to extend the life of the pavement. We start with that thing, and now, if you've seen the plans, we are getting to some arterial and collectors that are kind of far away from the main core of the sewer project, so they will be in phase 2 or 3 of the project, but they need to be addressed right now as major arterials for traffic.
Yes, especially when we don't know when that phase 2 or 3 may ever happen or when it will happen. All right, I just want to remind the members of the public that the Yucca Valley citizens who make up the Revenue Measure Oversight Commission reviewed this proposal and approved it to move forward. So any Measure Y and Z monies and so forth, the Citizens Oversight Commission takes a look at it. So we have an extra set of eyes on this, and they gave us the recommendation to move forward. Any other questions or comments? Otherwise, I'll entertain a motion.
I'll move we approve.
I'll second.
Council members Droz,
Yes.
Lombardo,
Yes.
Schooler,
Yes.
and Mayor Abel.
Yes. Wonderful, thank you. Item number 26, we're going to the appointment of the voting delegate for our upcoming League of California Cities Annual Conference.
Good evening, Mayor and Council. This next item before you is to appoint a voting delegate and an alternate for the business meeting at the League of California Cities Annual Conference. This year, the conference is being held September 22nd through the 24th in Sacramento. So the League asks each city to make formal designations for a representative to cast votes on behalf of the organization. Only persons so designated are allowed to do any kind of voting. This year, council members Dennison and Lombardo will be attending the conference. As part of the League's annual business, any pertinent resolutions that will be up for consideration will be brought before the council for review at your September 7th meeting based upon your legislative policy. So the recommendation is to designate Councilmember Dennison as a voting delegate and Councilmember Lombardo as the alternate for the business meeting of the 2021 League of California Cities Annual Conference, However, the designees could be reversed if the councils prefer. So this concludes the staff report, and I'd be happy to answer any questions following public comment.
All right, we'll move to public comment. All right, hearing and seeing none, we'll bring it back. My understanding from Councilmember Dennison is that usually these votes take place at the very end of the conference, one of the very last items to take place, and he stated that he was going to be able to commit to the entire conference all the way to the very end. So that was one of the reasons I think the recommendation came that although either one are very capable of voting on our behalf, he was going to be willing to make sure and stay. So are we good with the recommendation of Dennison and Lombardo?
Yeah. I'll be going also, and I plan to stay to the end.
Okay, very good. Thank you.
I move we approve the recommendation.
And I'll second.
Councilmembers Droz,
Yes.
Lombardo,
Yes.
Schooler,
Yes.
and Mayor Abel.
Yes. Our last department report, item number 27, COVID update.
Thank you, Mayor and Council. We haven't had a COVID update for a number of months. I think you'll see in some of the slides tonight, April was our last time that we looked at this. So thought maybe we wouldn't have to do these again, but here we are a number of months later, and we're going to start some of the updates and related actions along with it. So in summary, statewide numbers improved considerably late spring to early summer. You'll remember the colored framework. You'll see a couple of those slides again. But as those numbers improved, state removed all of their restrictions. Recently, however, those numbers are worsening, and you'll see that again in some of the graphs. Interestingly, you'll recollect that the framework that the town operated from the inception of COVID protocols was that we would take direction from San Bernardino County Department of Public Health, who took direction from the state, and the state issued their own recommendations as well as their own directives in many cases based on their understanding of the science as well as what was provided by CDC. So worked as basically federal, state, county, town, and the town really did, as we don't have our own Department of Public Health, so we were dependent on guidance that came out of the county. In this go-around, currently the state has not issued very many directives. They have issued recommendations but not directives, so it's a marked difference from their response earlier in 2021, as well as quite a bit different from what they did in 2020. We'll leave that interpretation to individuals as to why. Current update, again, county lifted the colored tiered system in around June 15th. The numbers remained low for COVID cases until just recently. And then again, the lead agencies there as we've identified. You'll remember this painful tier that restricted the activities in not only San Bernardino County, but also in the town of Yucca Valley. For information purposes, we put on there where we're at today, as of today. So if we were to be under the framework that was in operation prior to June 15th, we would be not only in purple, but we would be way in purple. So basically, adjusted case rate, purple was the most restrictive tier in the blueprint framework, was case rates of over per 1,000 over 7. And our current status there all the way on the right-hand side is 22 as of last week, with a testing positivity rate of 9.8. So well spread and widespread under current conditions. Again, this matrix showed what would occur in the prior framework. So under widespread, many non-essential indoor business operations were closed. That's when we had restaurants in town that couldn't open, beauty salons, et cetera, that affected many of our small businesses. The cases are equally as high as they were, but the state has chosen not to move forward with this. And I think for many of the business owners, that's probably quite a relief. So the recent actions that the state have done is provide daily updates and recommendations. They have provided some directives, but generally very few. They do have a recommendation for universal indoor masking, but that's as a recommendation, particularly those for who are unvaccinated. So let's take a quick look at the pictures of what it looks like. You'll see here this starts back at the beginning of the pandemic in March. And you'll see a bump. Those dates there on the counties, I'm looking at it now, I'm just realizing those dates are incorrect all the way on the left-hand side. That should be March of 2000. And then moving forward. But you'll see the spike there in the winter months, and then now all the way on the right-hand side, you'll see that rise starting to rise again, reflecting the increase in cases. These two next slides are compare and contrast. So this is the one from April 6th in your last update, and this is related to the percent of occupied beds due to COVID. So you'll see that big spike in the December, January, February timeframe. Excuse me. This is where we're at today. So it dropped off in the late spring, early summer, and now you're starting to see that bump up again all the way on the right-hand side. Town data, this will give you another good compare and contrast. This is your slide from February. This was at the height, I would say, of the COVID infections prior to the Delta variant coming out. So at that time, we were well in purple, and we had 25 cases per 100,000, and the positivity test rate there of about 7. In April, that had dropped down to about 12, and our positivity rate was going down. We were trying to get to the yellow tier so that businesses could reopen, et cetera. And then as of last week, again, new cases, 22, back up to 22 per 100,000, and a pretty high positivity rate. So this is an interesting chart. We never like to look at this one, but you can see the impacts on deaths. So fortunately, that has not increased, it has not spiked, it has stayed flat. The county has specifically put on here the information on the left, which is that first box underneath total deaths, and that's deaths with known vaccination status since February of this year. So fully vaccinated, 6, and then not fully vaccinated, 148. So they've put this information to demonstrate the effectiveness of vaccination. Just as a note there underneath that 6, it does say there are 79 deaths with unknown vaccination status. So, and then that same information for the last 14-day period, 1 fully vaccinated, 0 not fully vaccinated, but 5 deaths without any vaccination status. So fortunately, I think as a demonstration to the way that the medical community has been able to address infections that they're seeing, both at a clinical status as well as at an inpatient status, probably have pretty good techniques of dealing with COVID, fortunately. But let's talk a little bit about resources that are available for our community. At Joshua Tree Community Center at Sportsman Park, people can still get tested at any time, Monday through Saturday, 10 a.m. to 6. These are free testing resources as well as take-home test kits available. If anybody needs a ride, we're happy to provide a ride. We have resources, partnership with MBTA to get people out wherever they need to go. County's focus, sole focus, primarily is on vaccination. So we'll want to spend just a few minutes here on vaccination. For vaccination, for those individuals that are interested, kind of the standing facility is again at the Joshua Tree Community Center. You can make an appointment or you can do walk-in. If you need a ride, we'll help you get there if you're interested in doing it. So those resources are standing all of the time. And then we'll have a slide at the end of what we call a special events as well. I think I have, excuse me. I think we have 3 slides here for vaccination data. This is at the very beginning when the vaccines were just coming out. So you can see there at upper left-hand corner, total doses of 192,000. 65,000. Just started to ramp this out in February. In April, started to ramp up again. They were up to just under 500,000 in April. You can see the kind of the slope of those charts there, still accelerating rapidly. And then this is where we're at as of today. So definitely have flattened out, but the county did celebrate their 1 millionth vaccination. We're pretty excited about that. Vaccination data for the town of Yucca Valley, we're at just under, a hair under 50% fully vaccinated, and then either fully vaccinated or first shot, just under 60%. That is, by the way, one of the highest rates relative to the Morongo Basin. I think 29 Palms is somewhere around 30%. Morongo's a little bit lower. I think Joshua Tree is right around the same number, maybe possibly slightly higher than Yucca. So pretty good success for this area. County's goal, stated goal is 70% they'd like to see. Town vaccination has a mobile point of dispensing, I believe is the acronym. And we had one on August 9th. We have another one coming up this Friday, I believe is the 20th. These are from 11 to 3 here in the community center. Appointments are able to be made. You can just scan that QR code, or you can do walk-ins as you wish. And both Pfizer's vaccine is available, as well as Johnson & Johnson. So that's here in the Yucca Room. And then for both of those events, 3 weeks after is the second shot availability. So I think what we're seeing in the numbers anyways is that anybody that wants a vaccine should be able to get it, and should be able to get it easily at no cost and have no issues with transportation. I think the bigger challenge is there's probably a good number of folks that for one reason or another choose not to get a vaccine, as is their right. Town services, we are currently open for all of our services. Again, a couple of closing slides as the outbreak continues, and then resources. This is a great site, sbcovid19.com. You could do vaccine appointments, you could do COVID testing appointments, it gives you school guidance, COVID resources. The county also is providing transportation resources for those that need it. And again, on our website, we would have at our top of our banner, you can click on it and it'll give you those same resource links. So Mayor, Council, that's the update for this go around. Hopefully we'll get to a point where we don't need these anymore, but for now, that's where we're at. Be happy to answer other questions after public comment.
Wonderful. We'll open up to the public. Any questions? All right. Hearing and seeing none, we'll bring it back. First of all, it's great that we actually were able to have a site right here for our local residents. I was really excited that the 9th and the 20th were the 2 dates available. How did we go about getting that site? And do you know what the participation was in the first opportunity?
So, and these aren't the only ones. I believe we did one earlier this summer in conjunction with our senior center. We had one serving those folks as well. County is very active and would like to achieve their 70% target and goal, so they have reached out to try and get to as many communities and make it as easy as possible. So we have ongoing dialogue and relationship with the county, have been able to set these dates up here in September. And really the idea was making sure that people that are in Yucca can get here easily, number one. Number two, to do it in conjunction with the starting of school. For those families that are interested in vaccinating their kids 16 and older, they would be able to do that easily here as well.
And do you know the participation in the first one?
I would just characterize it as light. I don't know what the actual numbers are, but we'll follow up with county and try and find that for you.
All right. Is there anything that we can do as a town to help promote it besides the advertising? Is there any incentive or anything that we can do? I believe you said we could provide transportation if that becomes an issue. Anything else that we could possibly do to really get more participants?
There probably is. I think that would be a policy issue for the council. If you want that as a future agenda item, I think that would be direction to give us. There's definitely resources that are available. So if it's the desire of the council to take a an active role in incentivizing vaccinations, then just give us that guidance so we can come back and provide you with what that framework might look like. But that's definitely something that we would have the possibility to do. We do have a number of steps that we are currently taking. Deborah's been in contact with our partners at Morongo Unified School District to let them know of the convenience of this site. We've used all of our social media platforms and other PR platforms to get the message out.
All right. Well, I got the chance to participate in the vaccinations at Copper Mountain College. It was really a very quick process, no long lines. It was very pain-free. It was an excellent way of being able to distribute the vaccines and didn't have any real side effects and so forth, and then went back and got the second one. So the process isn't time-consuming. It's not painful, so hopefully more and more people will take advantage of that, because you see the actual hard numbers does show it does help as far as if you get COVID, it won't be quite as extreme, the symptoms and so forth. But as you said, that's everyone's personal prerogative and personal choice. Any other questions or? All right, so it's basically receive and file on that one, correct?
Yes, sir.
All right. All right. We'll move on to future agenda items.
At one time can we get an update on what's going on with the airport?
Yes, that's on your calendar. I believe that's scheduled for October, first meeting in October, I believe.
And does anyone want to look at any staff ideas to help promote the vaccination opportunities or not?
I'll go along with that to see if there's anything.
Only if we have consensus. All right. If not, we can talk to town manager privately if you want to ask more questions about that, and maybe we can get on a future agenda item if it's of importance. All right. Any other items? Okay, we'll move on to public comments. The town council takes this time to consider your comments or items of concern which are not on the agenda. When you are called to speak, please state your name and community of residence. Please limit your comments to 3 minutes or less. Inappropriate behavior which disrupts, disturbs, or otherwise impedes the orderly conduct of the meeting will result in forfeiture of your public comment privileges. Town council is prohibited by state law from taking actions or discussing items not on the printed agenda. Madam Clerk, do we have anyone wishing to speak tonight?
Yes, we have a request by Beverly Scott.
Thank you. Come on forward. You can adjust the mic if you need to. Thank you for waiting all the way to the end of the meeting to come and speak to us.
Yes, I'm Beverly Scott, and I'm here tonight as a concerned community member. Perhaps the town council remembers over a year ago now it's been that the County Board of Supervisors issued a proclamation stating that racism is a threat to the health and well-being of people of color and other minority populations. It's my understanding that the town of Yucca Valley signed on to this proclamation, as well as 23 other towns, communities, municipalities. And I'm here tonight to encourage the town council to pursue this. It's been a while now, and I, as well as other community members, have been waiting to see the town council pursue this. Now, part of this proclamation was supposed to include community members, and I haven't received any update. I, as well as others, have been following this pretty closely. And I am concerned. I was hoping that the town of Yucca Valley would pursue this before now. So I'd just like to let the town council know that there are several of us out in the communities waiting to hear on this particular subject. I know the county is working on this still. They have a group of people that meet on a regular basis. So I would appreciate it if the town of Yucca Valley would do so as well. And please include the community in this. I have one more thing. Governor Newsom has stated that there will be monies coming down to address the homeless situation in all of California. And I would like to see if any money comes to the Morongo Basin, I would like to see money go towards permanent housing for the homeless. Not a Band-Aid approach, but permanent housing. And I think others would like to see that as well. Thank you for your time.
Wonderful. Thank you for coming tonight.
You're welcome.
Our lights haven't been working the last 2 meetings, but we do have the counter going, right? All right. Any other members fill out a form? Anyone in the audience or here in the public who would like to speak that didn't get an opportunity, please, yes, come on forward, state your name and place of residence, and we'll give you 3 minutes. Let's wipe that down for you, the mic. Thank you.
Thank you. My name is Casey Kiernan. I live in Joshua Tree. And I wanted to make a quick comment. Yeah, MCC, I got my vaccination. I was in and out of there in like 5 minutes, like literally. And I think 5 of that was probably waiting in line. I mean, waiting to get it where they have you sit.
Right.
You know, so what I want to talk to you about is I'm doing a documentary on Joshua trees. So it kind of hasn't been discussed in a while. And I wanted to ask, who do I contact to get interviews with the members of the town council? Can you answer that?
Yes, we have a website on our on the town's webpage that you can click and you can invite any or all members if they would like to participate in your project.
So yeah, I've been on the website and I've emailed virtually all of you guys and no one's responded.
Oh, okay, I'll make sure and respond, so I apologize for that.
Can I get a name?
Abel?
Okay, thank you. So are you allowed to answer questions, or?
Not tonight, but you can contact me if you would like to discuss what you're doing and what project you're doing.
Can I get a show of hands? Or after the meeting. If you believe.
Or after the
Can I
meeting.
get a show of hands of you guys who believe in climate change? Sure.
We'll be glad to talk with you after the meeting.
No hands? All right.
We're not allowed to respond.
Oh, climate change? Yeah.
Yeah.
If you believe in climate change? Climate changing all the time, so yes.
Okay. Why someone? Thank you very much.
Thank you.
Hang around.
All right, anyone else? And thank you again for waiting all the way through that very long meeting to speak to us. Appreciate that. All right, seeing no other public comments, we'll bring it back to our staff for staff reports and comments.
Thank you, Mayor. We may have some. It's been a while since we've met, so I'm going to give the opportunity for staff. I'm going to start with Lieutenant. Do you have any updates for us? Holding down the fort while Captain's gone.
Good evening, Honorable Mayor and Council. Captain Niles is on a well-deserved vacation in New York right now. So since we last met, as I'm sure you're all aware, Sheriff McMahon retired recently, and the Board of Supervisors has appointed Sheriff Shannon Dykes. So we're excited to move forward under his leadership. He's, as I understand, went to 29 Palms High School, so he has some connection to the basin. And under Sheriff Dykes, he announced just recently that the Morongo Basin Station will be getting 4 new deputy sheriff positions for our unincorporated areas for the county. So we're excited. I think any additional staffing to the station benefits the entire basin as well as the town. So we're excited to get those bodies. We don't have them yet. We anticipate hopefully by the end of the year, maybe the beginning of next year, to actually see those deputy sheriffs in patrol cars and out and about. So we're excited in that. The new sheriff has also allocated some crime suppression money to the town to be used for traffic enforcement. So we'll be doing several operations within the town between August and October. It'll be an enhanced traffic enforcement throughout the town. It'll be about 4 to 5 deputies per operation and a supervisor. And along the same lines of traffic operations, with the upcoming school year starting next week, we'd like to remind the community to drive safe in the school zones throughout the basin. There will be some enhanced traffic enforcement in the town and throughout the basin next week, so please slow down for the school zone. I know it's been a year since we've been in-person schooling, so mind your P's and Q's, drive safe so that everyone can get back to school safely. And some future news, something I just want to say tonight, but we'll talk about it a little later in future meetings. October 21st, we've planned our National Night Out event here at the Community Center. It's from 4 to 8, I believe, is the hours, October 21st. We'll have the static displays of our vehicles and things for the youth to climb on and play with. We look forward to that event every year. So again, that'll be October 21st, starting at 4 p.m. And I'd be happy to answer any questions if you have any.
Thank you, Lieutenant. Sue, you have anything this evening for an update?
Well, our summer programs are wrapping up. The aquatics program last day was last Friday, August 13th. So just a great program. So glad we were able to do it again this year. And one of the most popular additions over this year and last year were evening lessons. So we captured customers that we didn't have before. So to see those 6 p.m. Swim lessons sell out is just great for us to know that we met a need. So, we're offering those, 4 p.m. to 6 p.m. lessons for parents to give them enough time to get out of work and bring their kids for swim lessons. Very, very popular. So we're so happy that we can provide something that they can use and the opportunity to bring their kids. Concerts are completed. Thank you to those of you who hosted for us. We really appreciate it. I know the 4th of July one was very well attended. The other 2 concerts a bit lighter, but staff did notice that even though it might have been a light crowd on the field, that there were many, many people watching from their cars in the parking lot. So when they would walk through the parking lot, they would see mostly seniors, with the windows down, and weren't really ready to get out on the field with everyone, but were present. So that was really great as well. Our sunrise run this past weekend, we had 42 runners and walkers, which is actually a really good turnout for this. First of all, it's a crack of dawn, so we had a coffee cart out there, get them juiced up, ready to go. And but really a good turnout for that event. Still plenty of things for folks to do. We are running enrichment classes here at the community center, and we are open, more regular hours now. We're open 9 to 2, Monday through Thursday. So there's a little more we were open 2 days a week. Now we're open more regular hours. Our drop-in softball program is underway. They are playing out there right now. It's in our 2nd week, and it's popular. People are interested in doing outdoor activities. So we're almost at capacity. We're just at a few people short of capacity both last week and this week. So people really want to get out there and play ball. In addition to that, we added a little short fall softball season. We don't normally do fall, but we went ahead and we just felt like people wanted to get out there. So we offered Thursday night co-ed. It sold out. So we have 6 teams. That's about 100 people that will start playing on September 2nd. So we're super happy to get folks out there and have some activities for them to do. The museum also pretty active. They have a concert this Sunday, the 22nd. You can purchase a ticket for the virtual presentation for $5, in person for $10. They're also working on their new Route 66 exhibit, which opens this Thursday, August 19th. And I saw them pushing a car into the museum. So, what? Could be a sight to see. Didn't know a car would fit through the doors, but apparently it does. Our giant rock exhibit that we created through Cal Humanities Grant, that's in the final stages of public feedback, and the final report will be created and sent to Cal Humanities by the end of September, and that'll be done. But the giant rock exhibit, really popular. Once people saw it, they started bringing in things for us, so we'll be expanding it right away because, you know, once they saw it and they saw how great it was, and you know, the Integratron and all the other aspects that it talks about, they're really excited and said, I have something at home I want to show you. So it's pretty cool to see that coming out of the community once they saw the presentation. And also the museum is open. They've kept the morning appointments, so if you want to come, you know, just with your household, you can make an appointment in the morning, and then from 12:30 to 5 is just walk-in traffic. So it kind of provides both for those who, you know, want a private appointment. They can do that. The feedback we're getting from the museum staff is the morning appointments are mostly locals. The afternoon appointments, and especially on the weekends, are almost entirely tourists. So we'll be thinking that through, you know, as we do our next guide and all of that, is trying to get more materials in there to service the tourists, because they ask a lot of questions. They, you know, we send them to the Welcome Center, but, you know, it's really great to see all those folks, and we want to make sure we have resources for them there at the museum. We are in production for our fall-winter guide, which will be distributed in mid-September. And then we also wanted to let you know that we are, for facilities, is moving forward. Indoor reservations are now accepted. So we are getting some of our regular meeting groups like hospice and some of these other groups that normally would meet at the community center are coming back in. And then we're also getting some requests for baby showers and things like that with the community. So that's all I have.
Terrific, thanks, Sue. Any questions for Sue?
Sue, do we have a presence at the California Welcome Center advertising the museum for people to come over and look at it?
I don't know. We usually put our guide there, but of course we haven't had a guide for a while now. But we can follow up with them and see.
Yeah, that might be great to, like, some kind of a banner or something big that says, visit our museum, free museum, or come learn about our history and our free museum, and send them over there. Because like you said, we're getting people that are coming in that visit the area. That might be a way to even bring some more folks through.
Yeah, and they really enjoy the museum. They really, you know, of course, you know, they get a lot of really positive feedback on Facebook and other social media, and the staff are just excited.
Well, good. Well, I guess
by a lot of customer service going on there, because they're so
good.
happy to have everyone back in.
Well, that's great. Yeah, and it's something for people to do. And like you said, Yelp reviews, any kind of social media, people talking about it, what they're to do, that would bring people in. So that's a great job. I guess if they can put a ship in a bottle, I guess we can get a car in a museum. So I'll have to go over and check that out. So you got me curious now.
Yeah, right?
Yeah.
Exactly.
Thank you.
Thank you.
Deborah, Armando, either of you have anything this evening? All right, Shane.
Just a couple things, Mayor and Council. Following up on the Lieutenant's comments about the school year, on the traffic engineering side, the street crew has been refreshing the school zone painting, as well as reestablishing the timers on the flashing beacons and the radar speed zones. Can't stress enough, as the Lieutenant said, to drive safe. Especially in those school zones, the traffic volumes and patterns in this community change dramatically during the school season, and people haven't been driving to the schools since March of 2020. So please be careful in those areas. Yucca Valley Animal Shelter, there are dogs and cats available for adoption. Please visit the shelter and pick up your next forever pet. At the shelter, want to commend the staff. They have been working, I'm going to call it, for approximately 2 months without 2 full-time positions and 1 part-time position. So the few remaining staff that have been there have been putting in a lot of extra hours, getting services out to the residents of the community as well as for the care of the animals. So I want to say thank you to those staff members who've put in that extra effort. On the private land development side, as the council is aware, Aldi had gone back to the Planning Commission with revisions due to lumber costs. They indicated today that they hope to be back in plan check tomorrow with construction beginning in October. And again, that's the 20,000 square foot Aldi store at the Rite Aid Center. Habit Burgers in plan check for those of you that frequent those fast food establishments. They've been having some discussion about a change in the franchisee who would own and operate that, but that does not appear to be stopping the project from moving forward. I want to thank the council for the joint meeting with the Planning Commission on the housing element. The housing element is now in the hands of the State Department of Housing and Community Development. Don't know if that's good or bad, but it's mandated one way or another, and we hope to have our comments back before October 15th and hopefully going straight to public hearing with the Planning Commission and then to the Town Council. We did receive word that the town has been awarded a grant for the housing element, approximately $115,000. When that paperwork is received, we'll be bringing that to the Town Council for acceptance of that grant. North Park design is moving forward, approximately 30%. We've had an internal staff meeting on that project this week. Hoping that that design is wrapped up in around October and then brought to the Town Council for authorization to go to bid for construction. One of the council's actions this evening was setting a public hearing date for utility undergrounding district formation and consideration of that process. That would be around Brem Park and Tri-Valley Little League and the Boys and Girls Club. It also would affect private property on the west side of Palm, where service is provided to existing single-family homes. So that hearing will be occurring at your meeting of September 7th. We'll be providing notice not just to the utility companies, but to those property owners as well. So you may have some attendance. There may be questions on what that process means. Onaga Trail and Little League, those are both federally grant funded projects. Those are approximately at the 35% design phase. Staff is going to be scheduling an outreach meeting with all of the affected property owners and the community as a whole, either the second or third week of September. So probably either on Wednesday, September 8th or Wednesday, September 15th for that community outreach. State Route 62, we've been told, we haven't seen it in writing, but the Caltrans contractor will be in town in September with their pulverizing machine and their paving machine and the trucks, starting the reconstruction process within the town limits in September. That's also tied to signal synchronization. The system is off right now. Because they're going through with the reconstruction project, the loops have all been disconnected and the signals are all set on timers. And they put, of course, the primary significant amount of time is for east-west traffic on Highway 62 and a lesser amount of time on the entering side streets. Doesn't matter how many cars are backed up on the side street, it's not going to affect the timing. That's set. So this is going to be going on through the entire construction project. It's going to cause some frustration. This is tied back to the school zones. You've seen, I think, a lot of traffic move off of the highway during this construction phase to get away from it, efficient movement. So Yucca Trail, Onaga Trail, those are the two major arterials that people use getting off of the highway. Well, those are the routes for our school sites. So again, we can't encourage enough safe driving, especially once the school year starts. Be happy to answer any questions if anything popped up.
I just was curious, did Potbelly Pig get adopted?
I'm not 100% sure. I haven't asked about the pig lately. Now, I was at the shelter on Saturday and I did not see him in his normal space. He had been replaced by a dog, so he may have been adopted. I'll find out for you, and if he hasn't been, I'll send you an adoption form via email.
You won't have
Well,
to kiss the
if he wasn't adopted yet, it wasn't because you haven't tried, that's for sure. And also great, I know Dr. Lombardo, Councilmember Lombardo loves underground utilities, and I do too. So we're glad to see that part of the town's getting a little bit of underground utilities, and of course, all new tract homes and so forth are all underground utilities. So we're moving in the right direction. So thank you for that report.
Thanks, Shane. Appreciate that. And thank you, Council, for your patience. This is what happens when you take 6 weeks off, so you get a little bit of deluge. Super excited about the new employees that you met tonight. Susanna, Evan, Rachel, just terrific additions to the town staff, and I think the level of expertise and education that the new employees are bringing is just terrific, and you'll have an opportunity to meet a couple new ones at your next meeting as well. Since we last met, we had the opportunity to meet with the state on our 2 Prop 68 competitive grants for a site visit. They came and walked both the skate park application as well as our Brem Park application. I think we consider them long shots a little bit, but we're hopeful that maybe there's a way that we can be successful this time. We put our best foot forward with the applications, and we felt that they at least, the questions that they asked demonstrated that they understood the applications very well. So they did spend the requisite time understanding that. I'm disappointed that Ms. Scott left this evening. Just as a way for the council to know, we have staff engagement at the community level for trying to remain in touch with the community groups that are interested in understanding both diversity, equity, racism, inclusion, all of those important topics. In fact, Deborah is our key point person. We've been in touch with what's called the Morongo Basin Coalition for Social Justice, asked them to keep us apprised of when they're meeting so that Deborah or other staff members can go and be engaged with this group and understand exactly what some of that concepts that are important to them and how the town might be able to assist in providing some kind of assurance as well as some kind of ability to help them attain their goals as well. So their goals for the entire community, and however we can help, we'd be happy to do that. So we'll reach out individually to Ms. Scott and let her know for sure that staff is engaged with that, as well as Councilmember Dennison as part of his duties with SBCTA on the subcommittee for the same. Likewise with Mr. Kiernan, he's left already, but staff has reached out to Mr. Kiernan and provided him an avenue to provide written questions that he would like answers to, and we've yet to receive those for over probably 6 months. So that has been done. Your fall schedule in terms of policy action items is going to be pretty full. You have a lot of things coming up, starting with redistricting based on your census data. The Prop 68 allocated grant project, your Aquatics and Recreation Center, is going to be moving forward. Policy discussions on short-term vacation rentals, as the council's indicated. Murals, all of those things will be moving forward between now and the end of the calendar year, so you definitely will keep you hopping for a while. I don't want to miss what the council acted on today, and that's Measure Y. Without Measure Y, this community would be $1 million less spending on infrastructure. So that's funding that you've authorized this evening to directly impact the quality of life for this community through improvements in infrastructure. And that's not possible without Measure Y. So we're so grateful to the community for their support for both Measure Y and Measure Z. Lastly, I had the opportunity to go for vacation for a week, and it's just when I come back, it's just a reminder what a great place we live here in Yucca Valley. The staff is tremendous, covering all the bases while I'm gone, while the council's gone. The work continues, and it continues because we have a terrific staff. So super excited to be back. Thank you for that time away. Appreciate it.
Thank you very much. We'll bring it back to the council member comments and reports. Councilmember Drodes.
I just want to say what a pleasure it is to be part of this town. There's so many exciting things going on, you know, from roads to Brem Park to everything we're doing. New fire station now, so it's really exciting. It sounds like we have more stuff coming up in the fall. So anyway, it's great to be a part of all this. And I just want to remind everyone to drive safe with school starting. I know everybody has said it already, but be very careful with the children out there. So, thank you.
Thank you. Councilmember Lombardo.
Well, I want to welcome the new family members, even if they are as young as our children. It's kind of neat to see that transition. I've been here, lost a lot of hair, but not quite as much as you. But I've seen the town change. Great education background. We're going to be well served in the future, and I think that's something that's real important when you love a town as much as this. You know, you want to see good people stepping up and stepping into the positions that are going to make a difference in the future, and I think we're in good hands. And I want to welcome you all, Susanna and Evan and Rachel, all to the Yucca Valley family, and we're looking forward to working with you all. I'm excited about the replacement fire station. Woo! Thank you, Chad Mays, and everybody else who was involved in that. That was awesome. A lot of long and hard-fought battle, I'm sure, for the funding. $12 million doesn't get squeezed out easily, but it's nice to see it happening. I just wanted to bring everyone's attention to the fact that a Yucca Valley resident he was a wrestling coach here. Vlad is Boynikov, and his protege was the woman that won the gold in the Olympics this year, and I got to see Vlad on TV. It was so neat. He was a local boy, well, not a local boy, he was a Russian immigrant, and he married my dental assistant. And we just formed a great friendship, and I helped form what was it? It was a scholarship for wrestlers that go from Yucca Valley into college, and we gave $500 for several years. We gave $500 a person to go on to college, and he was a forward-thinking person, and he was dedicated. That guy is an incredible force on his own, and he was here in Yucca Valley. We have a lot to be proud of, and so nobody can tell us we live in the middle of nowhere, because we are somewhere now, okay? Yeah. And I'm excited to hear about and see the Route 66 exhibit that starts in the museum. That should be interesting, and I do want to see how they push that car into the museum. So, okay. I want to thank everybody that helped allow our town manager to go on vacation for the week. All the staff, you do a wonderful job, and we really are just kind of superfluous. We just kind of make sure that what you wish gets carried through. No.
Thank you very much. Mayor Pro Tem Schooler.
Yes, I'm glad Councilmember Lombardo brought up Vlad Izboynikov. Actually, he was on staff here with the town of Yucca Valley in the Recreation Department for quite a while, a few years. And he was a real character, real good guy. While he was coaching at the high school, he was also working here. So really good to see his success. I'd like to echo what you said about Chad Mays. I think it's us getting money for this recreation aquatics center, as well as for the fire station, just kind of points out the advantage to having state and federal representatives come right out of our community. I'm quite sure that the money for both of those projects would easily have gone to another community if we didn't have a local representative there, and that's huge, and it's often overlooked, having that representation right out of our community at the state and federal level. So thank you to Chad for that, and I'm pretty excited about the fire station as well. I had the opportunity to attend the 4th of July concert and fireworks exhibition over there. Well organized, staff did a great job in putting that together. It was a really fun night and kind of signaled for the community getting back out from being locked up a lot. So I thought that was a real good event to do that, and a lot of people were there, had a good time, as well as headlights that, as people were parking up on the hills and around that area that didn't come into the park, but it was a great event. Also, welcome to the new staff, Rachel, and also to Evan and Susanna. Welcome. Happy to see you here. Valley Star presentation tonight, my eyes were opened on what they all do. I see their facilities, but they cover a lot of ground. I didn't really realize that. So that was a great presentation, and the enthusiasm that Louis has for his job is kind of really gets you going, and it's a great resource in our community. So with that, I mean, the presentations were great tonight, but with that, I'll conclude and turn it back to the mayor.
Thank you very much. All right, well, we appreciate everyone who spoke tonight, took the time to be here with us, and those who are watching online, we appreciate that as well. Also, just ask again for the community to have a lot of patience. It's going to be a long time before the roads get back to normal, and as we have all experienced the same thing, those signals and being delayed. And so again, Caltrans cannot fix it until they get those roads done. So be patient and be kind to one another out there. Lieutenant, again, please stay safe and continue. We'll continue to pray and lift up the officer. I understand he's in critical condition, or that officer. I'm not sure he or she is in critical condition. Again, it's a very risky job, but I appreciate your dedication along with our law enforcement brothers and sisters, so thank you for that. Fire department, again, you risk your lives as well, mental stress and physical stress and all kinds of things. You deal with the public, and that sometimes can get very, very dangerous. And we know fire season's just coming closer and closer. So again, whatever we can do as residents in supporting our law enforcement and our firefighters, we should do so. Clearing brush around our areas, obeying the laws and so forth, being good witnesses, and staying safe. So with that, we will conclude tonight's meeting. Our next meeting for the town council will be held on Tuesday, September 7th at 6 p.m. right here at the Yucca Valley Community Center. And be on your way and be safe.
All right.
Mayor, you can't get away quite that easy. You have a successor agency meeting.
Oh, that's right.
I'm going to recuse. I'm going to.
I don't think so.
I can't leave.
Accuse yourself.
Yes.
Have a conflict of interest.
This is item 38 in your agenda packet all the way at the end. This won't take very long, a couple minutes.
Good night, thanks.
All right, I'm excited to open up our next meeting. It is 8:10. We'll go start off with the roll call, please.
Agency members Dennison, Droz,
Here.
Lombardo.
Here.
Schooler, and Chair Abel.
Yes, here. Our staff report?
Yeah, probably should just follow the agenda. So approval of the agenda.
Oh, I'm sorry.
That's okay.
I don't have that sheet in front of me for some reason.
Should be in the last tab of your book.
The very last tab. Okay, thank
We
you.
approve. No.
All right, I need, I may or may not have it. Yes, I do.
I move
I
we
got it.
approve the agenda.
All right, we have a motion to approve tonight's agenda.
I'll second.
Roll call?
Agency members Droz,
Yes.
Lombardo.
Yes.
Schooler,
Yes.
and Chair Abel.
Yes. All right, consent agenda. All items on the consent agenda are routine matters, and we'll move forward with that. It can be enacted by one motion and a second, and have separate discussion if necessary or required. So do we have a motion for the consent agenda?
Move approval.
And is there anyone in the public wanting to make a comment on that? Thank you. I'm really out of sorts now.
Very good.
Do we have to televise these particular meetings? Well, we can
Gotta
burn the
televise all the
tapes.
screw-ups.
Yeah, burn the tapes. All right. So no public comments. We have a motion.
Yeah.
And looking for a second? Got a motion and a second?
Agency members Droz,
Yes.
Schooler,
Yes.
and Lombardo.
Yes.
And Chair Abel.
Yes. Sorry, I had already left the building with my mind.
Fine.
Department reports. Now we can go.
Thank you, Chair. This is a last and final ROPS update on the last and final ROPS, which might be the last and final time that you need to hear this. So that's the good news. This is just simply related to the administrative allowance. You'll remember that the way that the ROPS is set up is it'll pay the debt service that we used to have through, or that we still have from the former redevelopment agency. Legislation also provided an administrative allowance at a minimum of $250,000 unless adjusted by the Department of Finance or the Countywide Oversight Board. Countywide Oversight Board reduced the town's amount from $250,000 down to $169,000 in the last cycle. In the last and final, we had requested, I think, $150,000 roughly. We knew that the Department of Finance would not approve that. They didn't. They came back and asked the town to accept $5,000. We weren't comfortable with that, and through negotiation, we ended up at about $40,000. The only transaction that the former redevelopment agency has is debt service. That's paid twice a year. Nonetheless, we still have to do the annual reporting, we still have to do financial statements, and we have to do arbitrage, et cetera. So there's some administrative tasks. So the good news is we had the maximum amount, $250,000, since redevelopment agencies were dissolved in 2011, roughly. So we received that full amount for those years. And then this will be the amount moving forward, just under $40,000 for the rest of the existence of the successor agency's debt service, which is 17 years. So you have two options. One is to accept what staff recommended action is, which is to take the $40,000. Typically, most agencies that have one transaction are receiving administrative allowance of between $5,000 and $10,000. So I think we're doing pretty good with our $40,000. If the council desires to seek the legislative minimum, we would probably have to do that through litigation with the Department of Finance. And if that's the desire of the board this evening, then you can give us that direction. We have not heard of an agency that has been successful in that effort, though. So the recommended action is simply to receive and file the resolution that the board approved when you approved the ROPS. Included direction that staff can negotiate with DOF. So there's no further administrative action that either the board or the staff would need to do at this time. The only action that would be required is if the board desired to not accept the negotiated amount and pursue litigation, then we would need some kind of direction to bring back some alternatives to you.
Legal counsel, does that sound correct, that we just have to receive and file on this one? Okay. Because it seems like we're settling at a certain dollar amount, so it seemed like something that you would have to vote on.
Language in your resolution provided that flexibility last time.
Okay, very clever.
Yes, and I think if I remember right, the chair's comment was, well, it depends what the amount is, and I think staff's commitment was to come back and let you know and give you that option to accept or reject that.
Excellent. We'll open up for any public comments. All right. Everyone comfortable with receiving and filing the report and moving forward? Yeah. All right.
Yeah, I think we did well.
All right. Well, that's
Negotiation. Thank you.
good. No other public comments, no other things. It's with great sadness I call this meeting adjourned.